Recovery is stupendous.
Achievable.
Hope.
Freedom.
Empowering.
It's unique to everyone.
It's a journey, not a destination.
Getting a new lease on life.
It's finding restoration after you fall down.
Recovery is having the freedom to enjoy life.
For me, it was finding a way to really love myself.
My recovery is possible in part because of my own sense of purpose.
Welcome to Montana's Peer Network Recovery Talks podcast. I'm Jim Haney.
Hello, everybody, and I'm Lea Wetzel.
Thanks so much for tuning in to another Recovery Talks podcast from Montana's Peer Network. So, Lea, I don't know if you saw this, but over the weekend, the 2019 Miss USA died from suicide. I don't know if you saw that article. It caught my attention. It was kind of shocking.
Yes, it's very sad. I did happen to see that, and I read, she's got quite the background within being a former complex civil litigation attorney, and she was licensed in North and South Carolina and practiced it there. Really, really devastating for sure.
Yeah, and it made me think about, we heard a lot about this over the Summer Olympics, about pressure, mental health pressure from Olympic athletes began speaking out. And so this made me think about it as I was reading the article about this. She died in New York City. She took her life. She jumped off a building. And it made me think about it. I mean, I wonder what, a beauty pageant, she's beauty pageant. She won in 2019. So a couple of years ago. And I wonder what the pressures are there, the stressors. That's your job. You're a model, essentially. I guess I hope I'm using the right term. I mean, she's a model. She's a beautiful woman.
Yeah.
And right. And so she's in this competition with all these other beautiful women. She's Miss USA. So there's 50 other states, right? Or 49 other states. And I wonder what kind of pressure there is and what kind of support there is, for that type of thing. I mean, I think most women, don't they get into that pretty young, right? When they're modeling or beauty pageants. I mean, most get into it when they're pretty young. So maybe she had years of built up stress and.
Yeah, definitely. And, I can imagine the pressure of being A, young, B, beautiful, and C, a beautiful Black, intelligent woman in this day and age. And, just thinking back of, my era, 80s, 90s, and just reading about the pressure that models have and the access to substances they have. And,
Sure.
You see that a lot in the past within modeling, within athletes. And I think of ballet. Ballet is one that I think of where they just have to get that weight off, or gymnastics. They just have to be that certain size. And it's really, I've never been in that line of work, but it seems to me that it would be because we're mindful of these things these days. We're mindful of mental health. We're mindful of substance abuse. There's access to resources like trauma informed. There's access to peer support. You would really think, and all the funding that's out right now, you would really think they would have a lot more support than what they do.
That's the question, though, right? I mean, that's the question: is what kind of support do they have?
Right.
I mean, we don't know. I mean, we really, you would think, yes. I mean, there's a lot of public awareness, but what kind of support do they actually have? And you brought up some great points. Go ahead. I didn't mean to cut you off there. I just wanted to sort of underscore what you were saying, because I think that's what it made me think about was, what do they have? Is there support? I mean, like you said, I mean, eating disorders must be rampant amongst models and beauty pageants.
Just to be a girl, just to be a female, just to be a woman, this day and age, there is a lot of pressure just within that. I have a teenage daughter, beautiful, beautiful little girl. Well, I say little girl, but she's a teenager. And there's always that pressure amongst, I hear her and her little girlfriends talking. There's always that pressure amongst, oh, my nose is too big, my feet are too big, or, my legs are too skinny. And I think a lot of that is within the media, within, Snapchat. Everybody wants to be Snapchat perfect. And, I really feel passionate about bringing that realness. Now, I too I'm blamed for my profile picture being Snapchat. But,
Oh, you are really?
Yeah. And, I think it's time us as women, we really need to celebrate and really bring each other up. And life is more than that. It's not, it's more about what's inside of us. But, you would think within all, she had a lot going on. I was reading in this article.
She did.
So she had a extra receiving 2 daytime Emmy nomination for her work within, within entertainment. Sounds like she had a lot going on, but who knows what was going on in her, love life. Says here she has a mentor as well. We never know what's going on in their minds at that time.
Right.
Who of all people could really speak to being in that leadership role? What is that pressure like if something doesn't go right,
Yeah, I think that's a good point. And so I'm here in Livingston, Montana, and I'm gonna pull this all together here. So I think about this a lot. Because I'm in Livingston, Montana, and we have celebrities who live here. I mean, there's celebrities who live here, actors, musicians, news people, they live Paradise Valley, they live in Livingston, they live in Bozeman, Big Sky. That's part of living here. And I often think about people who were once famous. Let's say you're an actor and you were big in the 80s or big in the 90s, you did a bunch of movies or TV shows or something. And Hollywood or, being a star has sort of passed you by. You're still recognizable because you had a very popular show. But here's the thing I always think about. What do you do with your life? I mean, you're not going to work in the bank. You're a famous person. You're not going to go in the bank and be a teller,
right.
Can I help you, Mr. Haney? Right? I mean, you're not. And it's like some famous person, right? But I think about this because there are some who live here who used to be famous, but they're not famous anymore. They're a personality. You recognize them, you see them. They like living here because we don't have paparazzi and, right?
Yeah.
They can walk around, but they're not going to Albertsons and becoming a checker. You know what I mean? So they still have to make a living, but their heyday has passed them by. So when I read this article about her, and I don't know her at all. I don't know anything about her other than this tragedy that happened. But I think, she won in 2019 and then COVID hit in 2020. So I'm wondering what her experience was like as the winner. I think they go on a big speaking tour and a big promotional tour when you win, but that was probably cut short because of COVID. So she didn't get that opportunity, maybe the same as other people, and I'm just being hypothetical here, but I'm drawing this correlation between these people who reach some sort of celebrity personality status, but it doesn't last. Now, what do they do? So this woman went out and, I mean, it says she was on some TV shows, a correspondent, and she did have a lot of things going on in her life. But you have that place you achieved at one point, and in this case, she won Miss USA. I don't know, does it get bigger than that? I don't know. Maybe there's Miss Universe, but that's a pretty high level, and the fall from there can be pretty steep, right? Just like this actor or actress or musician or whatever who isn't popular anymore, that's got to be tough. I mean, you and me are regular people. We're not, right? You know, you can change jobs and nobody, but you're not going to see some famous person, you know, working at the drive-through. You know what I mean? Like, you know,
Right?
there's a part of that that's got to be hard to come to terms with. You've achieved this high level and now your life is not quite that way. I think about that and how do people cope with that piece of it?
Definitely. And just the other day, because I like watching documentaries and, listen to podcasts. And I'm listening to, there's this documentary about the 90s, in Hollywood, the Viper Room, and
Oh yeah.
there's all these Hollywood movie stars, and the guy from Counting Crows, he always struggled with mental health.
Yeah.
His thing.
Adam, the singer
Yeah.
you're talking about?
Yeah.
Adam Derwitz. Yeah.
There
Yeah.
you go.
Yeah.
Well, he was struggling with his mental health.
Yeah.
He was struggling with substance, and he said what he really liked about that Viper Room was that, he would get behind the bar and he would do bartending because he felt like an everyday average Joe. He said, I'm in the midst of 200 other, movie stars that are 10 times more famous than me. He could not handle that pressure of being famous.
It's got to be tough. It's got to be really, really tough, right?
Especially at a young age,
It's got to be really, really tough. You know, here in Montana, we have the ex-NFL player Ryan Leaf. So he was a quarterback, right? I think he was it Great Falls? Is that where he was from? I think, right?
Yeah.
You know, I think his signing bonus was $25 million. You know, you're 23 or 24 years old. If you have some issues in your life, mental health or substance use, trauma, anything like that, if you have anything like that, and you're 23, 24 years old and somebody gives you a check for 25 million, life is not going to go real well from that point forward. It's just not going to. You're too impulsive at that age. You're too impulsive. And if you don't have a solid foundation, things are going to go awry really quick because you can do anything you want.
Right.
That's the reality. You can do anything you want. Any impulse you have, you can do. So substances, drinking, sex, gambling, traveling, spending money. I mean, have you ever watched any interviews with Shaquille O'Neal, the basketball player guy?
Yeah. Very familiar with him. A few interviews.
He is hilarious. If you ever want to be entertained, just do a YouTube search for funny interviews with Shaquille O'Neal. There's one I've watched it a couple times because it's just so funny. So he's a young basketball player. He's got championships and all this stuff. He goes to Walmart and he bought $1 million. Did you see that?
Yeah, I see that.
Right? And his credit card gets declined. But he bought $1 million. Could you imagine walking into a store like Walmart and buying $1 million worth? You would need like a trucks, like multiple trucks to fill all this stuff.
U-Haul. Right? Yeah.
Exactly. But that's what I'm saying is that when you're young and you have that kind of money, you can literally do anything. And if you have any kind of mental health struggles going on, oh boy, you're in trouble at that point.
Yeah, devil's playground for sure.
For sure.
I've never had anything close to $1 million, but I did on my own construction company at 19, and I was the first ever in BIA history to get bonded by the BIA and complete the job because I wasn't insured, and I went in there as an independent contractor. No LLC, just coming in sole proprietor of all things. Well, my dad, he was so confident in the line of work. He'd been doing it for 20 years.
Right.
And we did a gravel crushing pit for Crow Agency. Finished it early, and I thought, I had like $27,000, I think was my first check. And that felt like 27 million. I was only,
I bet.
and it really was with my underlying trauma and my underlying addictions and mental illness myself. It really was devil's playground. Everything you just explained was me to a T. Impulsiveness with traveling, taking off. And I could imagine what my parents went through, me being so young and just gone traveling and doing whatever I pleased,
Yeah, I mean, it would be really tough. And again, getting back to, the 2019 Miss USA, her name is Cheslie Kryst, I think is how you say it. She was 30 years old, and we don't know the backstory of her. We have no connection, but it is kind of shocking when those things happen, and what's in place in her profession, in her field. She was in modeling for probably most of her life, and pageants and those kinds of things. And and then you go, and she has other career ambitions after that. There recently, Kellogg's, the company, Kellogg's, like Frosted Flakes kind of thing. They came out with did you see this? They came out with a new mental health awareness program for their employees. Which I thought was pretty cool, because Kellogg's is actually pretty big. Kellogg's includes, Frosted Flakes and Corn Flakes, Rice Krispies, Eggo, Mini Wheats. They're not a small company. And they launched an initiative to begin addressing mental health issues and stigma. And it was interesting because their director for retail operations, this Wilson Ray, wrote in the organizational blog that he says he gets winter blues. I don't know if he has a diagnosis or not, but seasonal affective disorder is a real thing, and it's a real diagnosis. Some people get it in the wintertime. But for him to come out and say that, I think is really like something, and right, like, and so anyway, so I looked this up. I started doing some more research on here, and I'm looking at an article. I'm on the News Herald from February 2nd. So I don't know when you're listening to this. Iosco County News. So they're talking about what's going on in Michigan, and talking about how important this is. And they're quoting this Wilson Ray, and he's talking about, hey, we need to take this stuff seriously. He's talking about his daughter's battle with personality disorder and a suicide attempt, and lost a nephew to suicide at one point. And this is what we need more of. We need more of this awareness. And so the organization launched a project internally called Lean on Me. It's their own brand of mental health first aid. So some of you listening might be familiar with mental health first aid. So this is their own kind of version of it, so they can own it as, Kellogg's. But it teaches people how to identify signs of mental illness and substance use disorders. And it gives people who take the training, some skills in how to support people. Mental health first aid is a huge initiative, federal initiative across the country.
Yeah.
Right.
Mm-hmm.
So it's, if anybody's listening, that's a course you can take. Montana, there's always courses available. But then Kellogg's went further, right? They partnered with Verizon, and they started this new global initiative. Did you want to talk about that, Lea? That larger, that is bigger than just Kellogg's, actually.
Right. Well, just going through this article and looking at some of these statistics, we're in a time with COVID going on top of everything else. 76% say that they are actively worried about their mental health of someone within themselves and someone on their team within work. You know, this person goes into the events of the past year are impacting everybody. New moms, dads, kids, adolescents, you name it. And that is from Paige, I don't want to butcher her name, but Baum. She's at LSMW and founding director of the Motherhood Center.
Yeah.
But, 74% out there within this, within their study here says that 74 have questioned their own mental health. People, there's a lot of pressure just within COVID alone, within the workplace.
Yeah, for sure.
When I very first started, right after I did Peer Support 101 in 2020, I was working at a local agency here in Great Falls. And, the whole, they hadn't figured out, are they going to mandate masks? Are they not? Right before things were closing and then opened up, some places were still going. Is it okay? Can we, no fix for it, no medicine for it, none of that. We're all just kind of living in fear of it. And, for a mental health center, I really tried to follow the lead of what I'm being told. And it was scary. It was scary, having kids, being a single mom and being asked to still work in the workplace, volunteer at that. I was still on volunteer status.
Oh, wow. Okay. Yeah.
But because of the passion for helping others, I was there.
Right.
But it was definitely a scary time. I remember that. And I know the pressures that are within, mental health agencies, for one.
Absolutely. Absolutely. Yeah. I think, the whole world experienced that in the, early 2020. I think we got shut down here in Montana, March of 2020, and there was this sort of unknown, what is this virus and how serious is it? And I can remember watching there was that map. I think the CDC put the map of the United States and they had the red dots everywhere there were cases, and the map was black, but then it just kept getting redder and redder and redder. And you're like, this was like some movie, some apocalyptic movie, the number, the counter just kept going up. I mean, literally, as you were sitting there, how many people were infected just kept going up. I think it was very scary. And we haven't really addressed it as a nation. We haven't addressed the trauma of that and what that's done. And it's still going on. I mean,
Yes.
We're in 2022 and we're 2 years, in a couple months, we're going to hit the 2-year mark. We still haven't addressed that. We still have let that go. And that's why I like this initiative. It's called Mind Together initiative, and Yahoo, like the search engine, Yahoo, Verizon, Kellogg's, and there's some other companies have band together, and they did this big study, and they're putting out this, it's called a mental health matrix. And we'll put this on our website and social media for you, but it's a downloadable, and they're calling it a white paper. It says the mental health matrix, the next generation approach for identifying and managing mental health in the workplace. I think this is critical. And I think there is not enough focus on mental health before COVID. And I think with COVID, I think there's a bunch of added pressure. You mentioned being a single mom. So, right, school that's got to be a huge source of pressure, like what's going on in the schools, but also daycare. I mean, I hear this from a lot of people who used to have daycare, take their kids to daycare, right? They're not going to school yet, they go to daycare, but now you can't because the daycare places are closed because they can't They can't keep them. So how do you do that? How do you manage your work? And I got my kids, and I'm trying to figure all this out. And there's workforce shortages, not enough people in the workforce. It's complex, and I have to applaud Yahoo and Kellogg's and Verizon, these companies that are banding together. It says here the study is based on a 2021 survey of 1,000 managers, human resource executives, corporate leaders in 6 global regions around the world: Canada, France, India, Taiwan, the United Kingdom, and the United States. And they're trying to get deeper into the issues around mental health in the workplace. They have a panel of 12 psychiatrists, psychologists, and corporate leaders in mental health. It's very fascinating. They have all their credentials and stuff listed here. It's a very diverse group of people. Some of the statistics are pretty surprising, aren't they? I really think they are. Yeah.
Yeah. Another quick statistic is 70% of managers say their company doesn't currently have policies or procedures for addressing the mental health concerns of employees. And the gap between recognizing mental health as a workplace issue and creating a company culture that effectively addresses it is a big one. Corporations are struggling to make the leap. Employee trust is low, stigma is high, and fear of discrimination is real. Wow.
Well, that's a huge one. The discrimination piece is a huge one, right? Mental health has a ton of stigma around it to begin with. It always has, it probably always will. It would be lovely if someday we could, talk about mental health issues like we talk about, other things, right? Other health conditions, but I'm not sure we're anywhere even close to that. So if companies take the steps to have welcoming, inviting policies and procedures, and have open door policies, and they encourage that, they talk openly about it. And we're different here. I mean, I'm saying this as an executive director because we're a recovery company, so we're constantly talking about recovery. There's a high sensitivity to that in a company like ours. But that's not the case across the board. I mean, you talked about your own experience working for a company that's providing services, and that's not the case. And I'd say that's not the case for most organizations. They really don't have policies or procedures in place, and they really don't have an open door policy, and aren't really in the right frame of mind. I guess I'll say it that way. They're not really in the right frame of mind to address mental health issues in the workplace.
Oh, definitely, Jim. I mean, where I am today, within the work I do, within who I work with, within what I do, and then who I am has gotten 10 times better since I've worked here. For one, working in different agencies here in town as a quote unquote peer support, working here for the company that built best practices for it and does the training, learning that half of what I was doing wasn't even peer support, wasn't even within my framework. Other things, I'll never forget the first staff meeting I went to with the counselors and everybody there, and I just really shied away from that clinical end of things because I was hearing such judgment, calling people out by their mental illness, by their and I was raised in a family, there's mental illness and addiction on both ends of our family. My aunt, I'll never forget, my dad's youngest sister, she had schizophrenia. And, I've talked about this before with my grandpa. He was a very prominent man, but he taught us and raised us, telling us, don't let society make you feel any less than, any different, keep you in a box because because you're different.
Right.
you know, and being somebody that has, um, you know, I have diagnosis myself, PTSD, and I've been diagnosed with borderline personality disorder, um, and an addict. But my biggest key piece within keeping my sobriety and keeping myself happy and be able to be balanced and working is keeping myself physical, mental, spiritual, and emotional. But really, that mental health is the biggest part within keeping my
Yeah.
recovery
Yeah.
going.
Yeah. 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 Exactly. I mean, it's key. And if you, so in the workplace, you know, either you're bringing stuff to the company, you go to work for a company, you might be bringing your own stuff, your own mental health issues, or there are workplace mental health issues that come up also in work environment. And it doesn't have to be extreme. The stress of just what you're doing, you know, of your job tasks can create a lot of stress. Getting up in front of them, and we've had people come work for MPN, you know, and we do presentations and trainings, and you know, we've been doing them virtually because of COVID, but traditionally we're in person. So the stress of having to get up in front of people and do presentations, and sometimes it's 10 people and sometimes it's 110 people, right? So
Hey,
those kinds of things can cause stress and anxiety for people, you know, and how we handle those and how we talk about them. You know, this in this report, there's a ton of really great statistics that came out of this survey. One of them that I find really interesting, the top 5 guides requested by management. So this must come through HR, right? It must have been the HR portion of the question. So what are the guides managers are most asking for? 60% said a guide on mental health conditions. The number two one was race and ethnicity. And that was only 35%. 60% of the time, the questions are about mental health conditions. I think that's really interesting, right? Like people, they, you know, that to me, that's saying I don't have enough education training to know how to handle this situation as a manager, right? I mean,
yes,
that's what it's saying. It's saying to HR, you're saying, human resources, help me out. I need to know more about these types of conditions.
yes, and also the trauma that we can take on by supporting others. If we're not
Sure.
knowledgeable of ways, because take take people like you and I. We have big hearts, we're good people, we visit with people. You know, it's hard to not take that stuff home, but to have the education and the mentoring and the support to learn how to handle those situations. You could
Mhm.
read all you want in a book, but then actually implementing it and putting it into your life. I'll never forget, I was working for MPN, I think a month, maybe 2, and I was asked to go speak somewhere, and Jim told me, take the day off, get yourself ready, because it was, last minute. I had to do it in like a day and a half, and I'm like, really? It was so uncomfortable to have a boss like worried about, no, take your time. This stuff can be stressful. Because it was always go, 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 never
Right,
taking time
right,
to
right,
and
right.
pretty soon we're dragging all that stuff with us, and half of it's
Exactly.
not even ours.
Yeah, 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 exactly. Yeah, I think, you know, what I learned over the years, you know, my own self doing, in this case, you know, presentation to, you know, a group of people, right, is um, if I don't clear my mind, if I'm not in the right frame, then I'm not going to be at my best, and I'm not going to deliver the message that I want to deliver.
Right.
And so figuring out what does that look like, and it's, you know, it just comes with practice. The more opportunities you have to do those kinds of things, presentations, you know, talks in front of people, you really have to be in the right frame of mind. You can't be just finishing up some other project and then rushing over and doing some presentation, because your frame of mind is still back at the last 2 or 3 things you did. You really have to prepare yourself if you want to give a top-notch performance. And that's just something that is embedded in our organization, and I know isn't taken into consideration for most companies. It's that what you said, it's the go thing. This report is really interesting, and I keep calling it a report, but it's a white paper because it has the survey results, but it gives some tools for managers, for HR departments, and it's interesting because there's a good quote in here. Companies are saying they don't know what to do because most people aren't using EAP, which is the Employee Assistance Program, which traditionally in America looks like this. You're having mental health struggles. Here, call this stranger and we'll pay for you to go talk to this stranger 3 times. That's typically what it looks like. That's typically what it looks like in the United States of America.
Right.
We basically we give no emphasis to people's mental health. That's all the emphasis we're going to give you is you're going to go talk to some strange counselor somewhere else 3 times, and then you better be better. You better be all fixed, and you're going to come back and do a better job at your work. Like that's the piece that has to change, and we have to think about this as ongoing. And nothing wrong with EAP, but I think that it's pretty tough as somebody who's gone to counseling off and on most of my life. It's pretty tough. The first 3 sessions with somebody is kind of just background. You're really just kind of giving them the background to get them caught up to where you are, to where, yeah. But that's it. That's our last session. You got to go back to work now. Like that's it. And so this white paper has what they're calling a mental health matrix, and there's 4 key actions, which is accommodating, arbitrating, addressing, and adapting. And it's really neat. I mean, I would encourage you, and we will post this up, on our website and social media and all that stuff to make it available. But it does look pretty neat, and I want to dig into this a little bit more. I like the fact that they're not just giving you information, and that they're actually giving you some tools to be able to use, right?
Yes, there's a lot of good information in here, folks, no matter what end of the spectrum you're coming from, whether
Exactly.
you're HR, whether you're an employee, it's really validating how we feel. And it's okay to feel that. I think shame and guilt can really be big within the workforce, and it takes a toll on us. So
yeah, for sure. They list here 41% of people report workplace burnout. Number 2 was anxiety, fear of what will happen in the future and how it will impact work. Long hours, that was an issue. Mental health, personal pressure, putting pressure on your teammates or yourself. Career burnout, that was sort of interesting, where you're just tired of what you're doing, just your career, just in general. This is a really, really interesting thing, because I think about the work we do at MPN, and to kind of bring this full circle, and why we're talking about this is because peer support is not just for people who are in SUD, substance use disorder treatment centers, or mental health or treatment courts. Like, imagine if we had peer support programs in the workplace.
every spectrum.
That it doesn't matter. It's not, I say this, PS 101, and, you were training people to be certified peer supporters. And it, I try to emphasize to them, this isn't unique to substance use. This isn't unique to mental health. this can be beneficial across the board. And imagine if we could have, with HR departments, if we actually had peer supporters,
Yeah.
Right? Like peer support, within the workplace. I mean, you'd have people who could provide peer support, and it's not 3 sessions with a stranger. It's one of your coworkers who you get to know each other, each other's lives. You're involved personally with each other, right?
Right. Like within any field that you're in.
Regardless, exactly. You work at the bank, and whatever, there's pressure of, handing out the right lollipops to people or whatever, and it's stressing you out, right?
Dog biscuits.
Yeah, dog biscuits. There you go, right? And the pressure, and you're just, making a joke there, but
Yeah.
no offense to bankers.
We love you, bankers.
Exactly. But, like there's workplace pressure, and maybe it is time for us to rethink EAP, employee assistance programs, and think about how can we have different conversations about mental health to make that part of our training, our regular training, mental wellness. And you said it, your spirit, emotionally, physically, financially, how you're taking care of yourself, help people with these skills. And to me, this ties right into COVID, because being healthy is a preventive measure from getting any virus. It is preventative if you are healthy.
Yes.
Right. And so maybe this is a good opportunity for our country to look at those kinds of things and change the conversations, and then go the next step, which is you have to change your policies and procedures. You have to change your culture. And
Definitely.
you have to begin thinking about people's wellness. Yeah.
Yes. When I hear you talking just now, I think of, here locally within Montana, Little Shell. I got to take a tour of their facility, and that's their whole thing is holistic. You come
Right.
in and that's how they're viewing it. And I really believe in everything you just said. If we had that knowledge, and if we start talking about these uncomfortable things, the more we are transparent with one another and keeping it real, because it's hard to keep a fake smile on all day long.
It is.
I think that adds to it.
Yeah.
So
Right. Yeah, no, I agree. All right, Lea. Well, we are out of time. This was a great conversation today, and a great topic, mental health in the workplace. And we're going to post that white paper for you. We'll make that available. People can go ahead and grab that, put it up on our website and social media. Great topic. Thanks so much for being here today with me.
yeah, definitely. Always an honor and privilege. And to our listeners, if there's some feedback about what we're talking about, if you'd like to come on and just visit with Jim and I, please get a hold of us, both of us, Jim at mtpeernetwork.org, and same with Lea at mtpeernetwork.org. Have a good afternoon.
See you later.
Recovery works and recovery is possible.
Recovery works and recovery is possible.
Recovery works. Recovery is possible.
Recovery is possible.
Recovery works and recovery is possible.
Recovery works and recovery is possible.
Recovery works and recovery is possible.
Recovery is possible.